The fluorescent lights in St. Catherine's Trauma Bay hummed at a frequency that made most people forget they could hear it. Claire Ashford heard everything. The blood pressure cuff hissing on bed 3. The charge nurse clicking her pen. The attending physician's leather shoes squeaking against linoleum as he approached her station. Dr. Victor Harrison stopped 2 feet from where she stood, reviewing a chart. He didn't speak immediately. That was his method. Let the silence pressure you into filling it with nervousness or excuses. Claire kept her eyes on the patient notes. "You're the new resident." Not a question. His voice carried the particular dismissiveness reserved for people he'd already decided weren't worth its full attention. "Yes, sir. First day on trauma rotation." Claire Ashford. He pronounced her name like he was testing its weight and finding it insufficient. Career change at 34. That's unusual. She looked up then, met his eyes for exactly 2 seconds before returning to the chart. Long enough to be respectful, short enough to avoid challenge. "I wanted civilian experience." "Civilian experience." Harrison adjusted his wire-rimmed glasses. "Your file says you completed medical school 8 years ago, but only started residency now. What were you doing in between? Selling pharmaceuticals?" The PA system cackled overhead. "Housekeeping to Station 2. Someone's pager went off across the bay. Research work. Nothing relevant to emergency medicine." Clearly. He reached past her and pulled the chart from her hands. "Your suture technique on the laceration in Bay 4. Where did you learn it?" Claire's expression didn't change. Standard interrupted method. "The spacing is military precision. Almost mechanical." Harrison flipped a page. "And you requested betadine instead of chlorhexidine. Old school field preference." "I study broadly." "Do you?" He closed the chart, set it down with the careful control of someone restraining themselves from slamming it. "Here's what I'll think, Dr. Ashford. You're hiding something. Maybe you barely passed your boards and you're hoping a busy ER will cover your incompetence. Maybe you froze up somewhere else and this is your second chance. I don't know and I don't particularly care. But if you bring drama or liability into my department, you'll be gone before you finish your shift." The words hung in the air like smoke. Claire adjusted her surgical mask, a small movement, precise. "Understood, sir." Harrison studied her face for something. Defensiveness, maybe. Fear. Whatever he wanted, he didn't find it. "There's a gallbladder in OR2 scheduled for noon. You'll observe. Don't touch anything." He turned to leave, then paused. "And Ashford, that robot precision might work on pigskin. But human tissue requires intuition, something you clearly haven't learned yet." His shoes squeaked away across the linoleum. Dr. Priya Mehta appeared beside Claire 30 seconds later, carrying 2 cups of coffee that had gone lukewarm an hour ago. She held one out. "Welcome to hell, Harrison's specially reserved level." Claire took the coffee. "He seems thorough. He's a brilliant surgeon and a complete bastard to anyone who doesn't fit his definition of a proper doctor." Priya leaned against the counter, which is basically everyone under 40 and anyone who didn't go to an Ivy League school. "Where'd you train?" "State University. Nothing impressive. But you did something before this. Nobody restarts at 34 without a story." The monitors in Bay 4 started beeping. Not urgent. Just a patient shifting position and pulling a lead loose. Claire watched the nurse handle it. "Just wanted a change." "Right." Priya sipped her terrible coffee. "Well, for what it's worth, that suture job you did was perfect. I've been doing this 3 years and I can't get spacing that clean. Practice. Nobody practices that much." Priya smiled. "But okay, keep your secrets. Just know Harrison's going to be watching you twice as hard as the rest of us. He hates mysteries." The PA system crackled again. "Dr. Harrison to administration. Dr. Victor Harrison to administration." Claire pulled her hair back tighter. The motion revealed a small scar above her left eyebrow, white and old and shaped like a crescent. Priya noticed it but didn't ask. The trauma bay doors burst open, 2 paramedics wheeling a gurney at speed. The patient was 19 maybe. Construction worker. Rebar through his left thigh and blood soaking through the temporary dressing. "Trauma 2, the lead paramedic called out. "Pulse 130, BP 90/60, lost about a liter on site." Nurses converged. Dr. Sarah Chen, the senior resident, took point. Claire stepped back. Observers stay out of the way. That was the hierarchy. But her eyes tracked everything. The angle of the rebar, the color of the blood. Dark red, venous. the way the patient's right hand kept clenching and unclenching. Chen called for imaging. Standard protocol. Get pictures before you pull foreign objects. The patient's breathing changed. Shallow and rapid. Claire's eyes moved to the monitor. Oxygen saturation dropping. 94. 92. Chen was focused on the leg. Everyone was focused on the leg. The smell hit Claire before the numbers did. Faint, chemical, sweet. She knew that smell. Her body moved before her mind finished the calculation. 3 steps forward. Dr. Chen. Not now, Ashford. His abdomen. What? Chen glanced up, irritated. Check his abdomen. Right upper quadrant. His injury is in his leg. Please, Claire's voice stayed level. Just palpate the right side. Chen stared at her for 2 seconds. Then, because she was a good doctor, even if she was annoyed, she pressed her hand against the patient's right abdomen. He screamed. Chen's face changed. Get me an ultrasound, now. The portable machine arrived in 40 seconds. Chen moved the probe across the patient's torso. Free fluid in the abdomen. Lots of it. He's bleeding internally. The rebar must have penetrated deeper than we thought. Chen's voice went sharp with command. D, call OR. Tell them we're coming up hot. Possible liver laceration. The room accelerated into controlled chaos. Claire stepped back again, out of the way. Chen glanced at her while pulling on sterile gloves. How did you know? The smell. Hemolyzed blood has a sweet smell when there's liver involvement. You can't smell that through all the other fluids. Claire said nothing. Chen stared at her for 1 more second, then turned back to the patient. Good catch. We'll talk later. They wheeled him toward the elevator. Harrison appeared in the doorway. He'd been watching from administration, had seen the whole thing. His face was unreadable. Ashford. My office. End of shift. Then he was gone. Priya let out a breath. Okay, so that was either really good or really bad for you. Claire pulled her mask back up. We'll find out. The monitors beeped steady rhythms. The PA system called someone else to somewhere else. And Claire Ashford stood in the center of organized chaos, her hands perfectly still, while everyone else around her moved like their lives depended on speed. Hers had, once, a long time ago, in places she wasn't supposed to talk about. The resident lounge smelled like burnt coffee and anxiety. 3 doctors hunched around a small table, voices low enough to stay private, but loud enough to carry conviction. Claire walked past them toward the lockers, pretended not to hear. I'm just saying, nobody picks up on liver involvement from smell. That was David Kim, second-year surgical resident. It's not physically possible with all the other fluids present. Maybe she got lucky. Jessica Roth, first year like Claire. Right place, right instinct. Twice, Priya's voice cut through. The sutures this morning were textbook military technique. I looked it up. That's not luck. Claire opened her locker. Inside was nothing. A spare pair of scrubs, a protein bar she'd forgotten to eat. No photos, no personal items. Nothing that said she'd been anywhere or known anyone. Military. David laughed. What, you think she's some kind of secret soldier playing doctor? I think she's been trained somewhere that doesn't show up on a normal medical resume. Or she watches a lot of YouTube videos. Nobody learns to suture like that from videos. Claire closed the locker. The sound made all 3 of them look up. She walked out without acknowledging them. The hallway stretched long and white under flickering fluorescence. Her shift ended in 40 minutes. Then Harrison's office. She'd been through worse debriefings, had sat across from colonels and intelligence officers, and explained decisions that saved lives while breaking every rule written. This would be simpler. Either he'd believe her cover story, or he wouldn't. Her pager went off. Not the urgent code, just a summons. Trauma bay, non-critical assessment needed. She took the stairs instead of the elevator. Kept her breathing steady. Muscle memory from a different life. Always take stairs. Elevators are traps. The trauma bay had settled into its afternoon rhythm. Controlled chaos replaced by controlled tedium. Nurses charting, residents reviewing labs. The low hum of people waiting for the next catastrophe. Bay 6 held a woman in her 50s. Margaret Chen, according to the chart. No relation to Dr. Sarah Chen. Admitted for abdominal pain and nausea. Vitals stable. Waiting on CT results. Claire read through the notes. Gallbladder inflammation suspected. Pain started 3 days ago. Got worse this morning. Textbook cholecystitis. She walked to the bedside. Mrs. Chen, I'm Dr. Ashford. How are you feeling? Tired. The pain is better now with the medication. On a scale of 1 to 10, way would you rate it? Maybe a 4. It was an 8 this morning. Claire nodded, picked up the chart again. Something nagged at her. A detail slightly wrong. Like a photograph where one element is out of place. The temperature, 100.2. Low-grade fever. Normal for cholecystitis. But the white blood cell count, 14,000. Elevated, but not dramatically. And the timing. Pain for 3 days, but only sought help now. Claire looked at the woman again. Really looked. Skin color, slightly off. Not jaundiced yet, but heading there. Mrs. Chen, has anyone asked about your urine color? The woman blinked. No, why? Have you noticed any changes, darker than usual? A pause. Now that you mention it, yes, since yesterday. I thought I was just dehydrated. Claire set the chart down, touched the woman's abdomen. Right upper quadrant first. Gentle pressure. Tenderness, but not severe. Then she moved lower. Right flank. The woman winced. Claire's mind calculated. Dark urine, flank pain, fever, elevated white count. When did you last urinate? This morning, maybe 6 hours ago. 6 hours, in a woman on IV fluids. I need to add something to your lab work. Has anyone discussed the possibility of kidney involvement? Kidney? I thought it was my gallbladder. It might be both. Claire flagged down a passing nurse. Can we add a urinalysis to Mrs. Chen's orders? And I want to see the CT results as soon as they're available. The nurse frowned. Doctor. Harrison already ordered the standard gallbladder protocol. I understand. I'm adding the UA. That's not your call. You're not the attending. Claire met her eyes. Then page Dr. Harrison and tell him I'm concerned about ascending cholangitis with possible sepsis. If I'm wrong, he can yell at me later. If I'm right and we wait, she'll be in the ICU by tonight. The nurse held her gaze for 3 seconds, then picked up the phone. Claire stayed with Mrs. Chen, checked her pulse, strong but slightly rapid, rechecked her temperature, climbing, 100.4 now. The numbers were whispering. She'd learned to hear them in field hospitals, where lab work took hours and decisions took seconds. Your eyes and hands and instincts became your diagnostics. 15 minutes later, the nurse returned. Her expression had changed. Urinalysis shows bacteria and white cells. Dr. Harrison wants a repeat CBC and blood cultures. He's Ning down. Claire nodded. Start her on broad-spectrum antibiotics, piperacillin tazobactam. I need an attending's order for that. You'll have it in 2 minutes. The nurse hesitated, then moved to the medication station. Harrison arrived like a storm front, fast and full of pressure. He went straight to the chart, read in silence. His jaw tightened with each page. Finally, he looked up. Explain. Cholecystitis, complicated by ascending infection. The bacteria from the gallbladder traveled to the bile duct and into the kidney. Early-stage sepsis. If we'd waited for the CT and treated only the gallbladder, the infection would have progressed. Based on what evidence? Dark urine, flank tenderness, low urine output despite IV hydration, temperature climbing despite anti-inflammatories. Harrison stared at her. Those are subtle indicators. They're sufficient. For someone with extensive infectious disease experience. For someone paying attention. The words came out sharper than she intended. Harrison's eyes narrowed. But he turned to the nurse. Start the antibiotics, admit her. I want cultures every 6 hours and nephrology consult in the morning. Then back to Claire. My office, now. They walked in silence, his footsteps hard against tile. Hers nearly silent. Another habit from another life. His office was small and obsessively organized. Degrees on the wall. Medical journals stacked by date. A single photo of him receiving some award. He sat. Didn't invite her to. 6 weeks ago, you were completely unknown to this hospital. Your references were adequate but unremarkable. Your interview was competent but not impressive. I accepted you into this program because we needed bodies and you had the credentials. Claire waited. In 6 hours, you've demonstrated diagnostic capability that most residents don't develop until their 3rd year. You identify complications before imaging confirms them. You move with a precision that suggests thousands of hours of practice. And you deflect every single question about your background. He leaned forward. So I'm going to ask you directly, Dr. Ashford. Where did you train? And don't tell me it was a state school research position. I've called colleagues. Nobody knows you. Nobody has published with you. You appeared in the medical system 8 months ago, like you materialized from nothing. The monitors beeped faintly through the wall. Someone laughed in the distant hallway. Normal hospital sounds. Safe sounds. Claire kept her voice level. I did research work that required confidentiality agreements. I can't discuss the details. Medical research doesn't create the skill set you're displaying. Then perhaps I'm just a fast learner who takes the work seriously. Harrison stood. You're lying. I don't know about what, and frankly, if you're competent, I don't care. But if you're hiding malpractice or a revoked license or anything that puts this hospital at legal risk, I will find out. And when I do, you won't just lose this residency. You'll lose your career. Before Claire could respond, her pager shrieked. The urgent code. Trauma alert. Harrison's went off simultaneously. They looked at each other for one beat, then ran. The trauma bay doors exploded open. Paramedics wheeling a gurney at full speed. The patient was maybe 25, male. Construction boots still on. Hard hat somewhere behind in the ambulance. Fell 3 stories onto rebar. The lead paramedic shouted over the noise. Impaled through the left chest. We didn't remove it. BP 70/40 and dropping. Pulse 150. He arrested once on site. We got him back, but he's circling. The team swarmed. Nurses cutting away clothing. Residents calling for blood. Harrison barking orders with the mechanical efficiency of someone who'd done this 10,000 times. Claire moved to the foot of the bed. Observers, stay back. She'd learned that 6 hours ago. But her eyes tracked everything. The rebar entered below the left clavicle, angled down and medial. 18 inches of rusted steel disappearing into his chest cavity. Blood pooling around the entry site, dark and pulsing with each heartbeat. The monitors screamed numbers. Oxygen saturation 86. Blood pressure dropping. 60/30 now. Get him to OR now. Harrison's voice cut through the chaos. We pull that out down here. He bleeds out in 90 seconds. OR3 is ready, a nurse called back. They started moving. Fast, organized ballet of experienced hands preparing to wheel him to surgery. Claire's eyes stayed on the patient's neck, on the faint distension of his jugular vein, on the way his trachea had shifted slightly to the right. Her brain calculated angles, trajectory, depth. The rebar hadn't just pierced the chest wall. It had likely nicked the pulmonary artery, and the pressure building in his chest meant blood was filling the pericardial sac. Cardiac tamponade. The heart couldn't expand, couldn't fill with blood, couldn't pump. He had maybe 3 minutes before the pressure stopped his heart completely. The OR was 4 floors up. Dr. Harrison. Her voice cut clear through the noise. Not now, Ashford. He has cardiac tamponade. Probably. We'll handle it in surgery. He won't make it to surgery. Harrison turned. His face was fury and focus. I said not now. His jugular veins are distended. Tracheal deviation. Muffled heart sounds. He needs pericardiocentesis now, or he'll arrest in the elevator. We don't perform that procedure in the ER. Too high risk. Higher risk than letting his heart stop? The monitors agreed with her. Blood pressure 50/20. The patient's eyes rolled back. Harrison stared at her for 1 frozen second. She saw the calculation in his face. Protocol said move to OR. Experience said she might be right. Pride said don't let a first-year resident override you in front of the whole team. The monitor flatlined. He's arrested. Dr. Chen started compressions. Claire moved without thinking. Muscle memory from 100 field hospitals where hesitation meant death. She grabbed a thoracotomy. Tray from the crash cart. Ashford, step back. She didn't step back. Her hands moved like they belonged to someone else. Someone who'd done this in the dark with mortars falling. Someone who'd cracked chests in the back of helicopters while blood sprayed the ceiling. Betadine across his left chest. The brown liquid running in rivulets. Scalpel in her right hand. Ashford, you are not authorized. The blade cut. Fifth intercostal space. Mid-axillary line. The incision was 6 inches and perfectly horizontal. Blood welled up. She'd expected that. Rib spreader next. The metal device went in smooth. She cranked it. The ribs separated with a sound like breaking kindling. The room had gone silent except for the monitors. Harrison stood frozen. Everyone stood frozen. Claire's hands didn't shake, didn't hesitate. She reached into the chest cavity, felt the pericardium. Tense and full. She made a small incision. Blood poured out, dark and under pressure. The heart beneath was barely moving, fluttering uselessly. She found the pulmonary artery, the small tear where the rebar had kissed it. Not a full rupture, just enough to bleed into the sac and suffocate the heart. Her fingers applied pressure, direct and firm. 3 points. a technique taught in a schoolhouse in North Carolina that didn't exist on any map. I need 4O proline suture, and get me 2 units of O-negative blood running wide open. No one moved. Now. Her voice didn't rise, didn't need to. It carried the weight of absolute certainty. A nurse's hands appeared with the suture, trembling slightly. Claire threaded the needle. Her hands were steady as stone. She placed 3 interrupted sutures across the tear. Each one perfect. Each one exactly where it needed to be. The bleeding stopped. She released pressure. Watched. The sutures held. The heart twitched. Then beat again. The monitor started beeping, slow at first, then faster, then regular. 60 beats per minute, 70, 80, blood pressure climbing, 40/20, 60/30. Claire stepped back. Her hands were covered in blood to the wrists. Her scrubs were soaked. She looked like she'd been standing in a storm of red. Someone should close the chest properly and get him to OR for full repair of the rebar tract. Her voice was calm, professional, like she'd just finished tying a shoelace. You'll need imaging to confirm no other vascular damage, and start antibiotics. That rebar was filthy. Harrison stared at her. His face had gone completely pale. The team moved. Dr. Chen took over, started the formal closure, called for OR prep. The organized chaos resumed, but different now, quieter. Everyone moving around the elephant in the room. Claire walked to the sink, washed her hands. The blood swirled down the drain in pink spirals. Kriya appeared beside her. What the hell was that? Emergency thoracotomy. Standard procedure for cardiac tamponade with arrest. Standard procedure in a war zone maybe, not in a civilian ER. Claire dried her hands, didn't answer. Harrison's voice cut through the bay. Ashford, my office, immediately. She followed him. Again. The walk was longer this time. Felt like walking to an execution. His office door closed with a click that sounded like a cell locking. He didn't sit, just stood there, staring at her with an expression that might have been rage or might have been something else entirely. That patient was clinically dead. Yes, sir. You performed an unauthorized procedure that violates hospital protocol. Yes, sir. You cracked his chest open in the middle of the ER using a technique I've only seen in military trauma manuals. Claire said nothing. He's alive. Harrison's voice dropped. Against all probability and every rule in this hospital, that patient is alive. That man is alive because you ignored me and did something no first-year resident should even know exists. He sat down heavily, suddenly looked older. I'm going to ask you one more time, and if you lie to me again, I'm not just firing you. I'm reporting you to the medical board for investigation. Where did you learn to do that? The monitors beeped through the wall. Steady now. A heart that should have stopped. A life that should have ended. Claire met his eyes. I can't tell you that. Can't or won't. Both. Harrison's jaw tightened. Then pack your things. You're suspended pending review. If you're lucky, you'll just lose your residency. If you're not, you'll face criminal charges for practicing outside your scope. I understand. Do you? Because that man in there is alive, and I have to decide whether to thank you or destroy your career. And right now, Dr. Ashford, I honestly don't know which is the right call. Claire stood. For what it's worth, I'd do it again. I know, that's what terrifies me. She turned to leave. Ashford, she paused. That 3-point pressure technique, where is that even taught? Her hand touched the doorknob. Nowhere you'd find in a civilian medical database. Then she walked out. Behind her, Harrison sat in his office and stared at the wall of degrees and achievements and 25 years of playing by every rule, and wondered what the hell he'd just witnessed. The disciplinary hearing was scheduled for 2 in the afternoon. Claire arrived at 1:50. The administrative conference room was designed to intimidate. Long mahogany table, high-backed leather chairs, floor-to-ceiling windows that made you feel exposed. 5 people sat waiting. Harrison at the head of the table, Dr. Patricia Vance, Chief of Medicine, Robert Chen, Hospital Legal Counsel, 2 administrators whose names Claire hadn't bothered to learn. She took the empty chair at the opposite end, folded her hands on the table, waited. Vance opened a manila folder. Dr. Ashford, you're here to address serious violations of hospital protocol. Specifically, performing an unauthorized emergency thoracotomy in the ER, disregarding direct orders from an attending physician, and operating outside the scope of your training level. I understand. Harrison has submitted a formal incident report. The patient survived and is currently stable in ICU. However, survival doesn't negate the breach of protocol. Vance looked up. Do you dispute any of these facts? No. Can you explain your reasoning for performing this procedure against Dr. Harrison's explicit instructions? Claire kept her voice level. The patient had cardiac tamponade. He arrested. Standard CPR wouldn't have resolved the underlying cause. The only option was immediate surgical intervention. The standard option was to continue resuscitation and transport to OR, Harrison said. His voice was carefully neutral. That's established protocol. He would have died in the elevator. You couldn't have known that with certainty. I did know it. The legal counsel leaned forward. Dr. Ashford, your confidence is noted, but medical decisions require documented evidence. What specific indicators led you to override standard protocol? Distended jugular veins, tracheal deviation, muffled heart sounds, classic Beck's triad for cardiac tamponade, combined with the trajectory of the foreign object and the rapid deterioration of vitals, surgical intervention was the only viable option. And your training in emergency thoracotomy came from where exactly? Vance's pen hovered over her notepad. Claire paused. Various sources. Can you be more specific? No. The room went quiet. One of the administrators shifted in his chair. Dr. Ashford, you need to provide documentation of your training, the legal counsel said. Otherwise, we have no choice but to assume you performed a procedure you weren't qualified to perform. I was qualified. Prove it. Claire met his eyes, said nothing. Harrison's frustration broke through his professional mask. This is absurd. I've reviewed your file personally. Your medical school records are standard. Your residency applications show no surgical subspecialty training. Your references are generic. It's like you didn't exist before 8 months ago. I existed. Then where? Doing what? Harrison's voice rose. Because that technique you used isn't taught in civilian programs. I've been practicing trauma surgery for 25 years. I know 3 people who can perform that procedure under pressure, all of them trained in military-forward surgical teams. The air in the room changed. Electric. Charged. Claire's expression didn't shift. I'm not at liberty to discuss my previous work. Not at liberty. Vance set down her pen. Dr. Ashford, that phrase suggests classified information. Are you claiming your medical training involved government work? I'm claiming I can't discuss it. Can't or won't. Does it matter? The legal counsel closed his folder. Yes, it matters if you refuse to provide verifiable credentials for a procedure that violated hospital policy. We have grounds for immediate termination and possible legal action. I understand. Do you? Vance's voice hardened. A man is alive because of you. But if you'd been wrong, or if something had gone differently, this hospital would be facing a wrongful death lawsuit. We can't have residents operating on instinct and classified training we can't verify. I wasn't wrong. That's not the point. That's exactly the point. Claire's voice stayed calm, but something shifted in it. Hardness. You're telling me protocol is more important than a beating heart, that paperwork matters more than a life saved. We're telling you that medicine requires accountability, Harrison said. You can't just appear out of nowhere with elite training and expect us to trust that on faith. I don't expect anything. I did my job. Your job was to follow orders. My job was to save the patient. Vance raised a hand. This isn't productive. Dr. Ashford, I'm giving you one final opportunity. Provide documentation of your surgical training or accept termination from this program. Claire stood. Then I accept termination. The room stared at her. Sit down, Harrison said. There's nothing else to discuss. Sit down. His voice carried command weight. Claire remained standing. I appreciate the opportunity St. Catherine's provided. I'll clear out my locker within the hour. She turned toward the door. Wait. The legal counsel pulled a different folder from his briefcase. Thinner, marked with a red stamp. Claire could read from across the room, even upside down. Her stomach tightened. Before you leave, I need to verify something. He opened the folder carefully. When we ran your background check for hospital employment, most of it came back standard. Medical school transcripts, board certifications, reference letters. But there was one item flagged by our security system. He pulled out a single document. Even from 10 feet away, Claire could see the header. Department of Defense, Personnel Records Division. Your file has a notation. Small, easy to miss. It says, and I quote, employment verification requests require SOD clearance authorization. He looked up. What is SOD, Dr. Ashford? The windows reflected clouds moving across the sky. The table reflected fluorescent lights. Claire's face reflected nothing. I don't know. You don't know what SOD stands for in your own personnel file? I don't know what you're referring to. The legal counsel smiled thinly. I called the number listed. Took 3 days to get someone on the line. When I finally did, they confirmed your employment dates, but refused to provide any details about your position or duties. The officer I spoke with used the phrase, compartmented information. That's intelligence community language. Harrison stood slowly. What the hell is this? I made another call, to a friend at the VA hospital. He has connections with military medical divisions. The counsel's voice dropped. He said SOD is an internal designation. Special Operations Division. Medical personnel embedded with Tier 1 units. The kind of doctors who parachute into combat zones and perform surgery in the back of helicopters. The room held its breath. Claire's hands stayed relaxed at her sides. That's a creative story. Is it true? Eve. And if it were, I couldn't confirm it. Vance leaned back in her chair. Dr. Ashford, if you have military medical experience at that level, why wouldn't you disclose it? That's an asset, not a liability. Some doors close for good reasons. What does that mean? Before Claire could answer, the conference room door burst open. A nurse Claire didn't recognize, face flushed, out of breath. Dr. Harrison, we have a mass casualty situation incoming. Construction site collapse, steel beam failure, multiple critical injuries. Every available surgeon to trauma bay immediately. Harrison looked at Claire, then at Vance, then back at Claire. How many incoming? Vance asked. First call said 12, 3 critical, more still being extracted. The administrators started talking at once. Logistics, resources, calling in off-duty staff. Harrison cut through the noise. Dr. Ashford is suspended pending this hearing's conclusion. We need every surgeon, the nurse said. ER is about to be overwhelmed. She's not cleared to. Victor. Vance's voice was sharp. Make a decision. Harrison stared at Claire. She stared back. The space between them filled with unspoken calculations. Finally, he spoke. You're reinstated temporarily. For this emergency only. When it's over, we finish this conversation. Claire nodded once. Understood. They ran. The hallway blurred past, elevator down to ground level, the trauma bay already transforming into controlled chaos. Nurses prepping multiple bays, residents gowning up, the distant sound of sirens growing closer. Priya appeared beside Claire. You're back? For now. What happened in there? Later. The first ambulance arrived. Paramedics rushed through the doors with a patient on a backboard. Male, 40s, covered in concrete dust and blood. Then a second ambulance. A third. The bay filled with voices and motion and the sharp smell of trauma. Harrison called out assignments, his voice cutting through chaos like a blade, sending residents to different patients, coordinating, commanding. His eyes found Claire. Bay 4, 30-year-old male, crush injury to chest and abdomen. She moved. Bay 4 held a man barely conscious, hard hat cracked in half, his breathing shallow and wrong. Claire's hands began their assessment. Fast, methodical, every movement precise. And in the distance, more sirens wailed closer. The patient in Bay 4 was drowning in his own blood. Claire could hear it in his breathing, wet, bubbling. The sound lungs make when they're filling with fluid they can't expel. His eyes tracked her face, trying to focus, trying to understand if he was dying. What's your name? She kept her voice calm while her hands moved across his chest. Palpating, assessing. James Kovac. James, I'm Dr. Ashford. You're at St. Catherine's. We're going to take care of you. His chest wall had visible deformity. Multiple rib fractures. Left side worse than right. Each breath caused asymmetric movement. Flailed chest. The broken ribs moving independently instead of with the chest wall. She placed her stethoscope. Left lung had diminished breath sounds. Right lung was working overtime to compensate. Pneumothorax. Air leaking into the chest cavity. Collapsing the lung. I can't breathe right. His voice was thin, reedy. I know, we're going to fix that. A nurse appeared. Claire didn't look up. I need a chest tube tray, 14 French, and get me portable X-ray here now. The nurse moved. Claire continued her assessment. Abdomen next, distended, rigid. When she pressed the right upper quadrant, James groaned. Internal bleeding, liver or spleen, possibly both. His blood pressure was 80/50, dropping. She looked at his face, at the concrete dust in his hair, at the wedding ring on his left hand. James, do you have family I can call? Wife, Emma. Phone's in my... He tried to gesture to his pocket, winced. We'll call her, but right now I need to put a tube in your chest to help you breathe. It's going to hurt. I'm sorry. He nodded, barely. The chest tube tray arrived. Claire opened it, pulled on sterile gloves. Her movements were automatic. Muscle memory from hundreds of procedures in worse conditions than this. Betadine swabbed across his left chest. 5th intercostal space, mid-axillary line. Lidocaine injection for local anesthetic. Not enough time for it to fully work, but better than nothing. Scalpel. The incision was small, precise. Hemostat to dissect through tissue layers. She pushed through muscle, felt the pop as she entered the pleural space. Air hissed out. The sound of pressure equalizing. She inserted the tube, guided it up along the chest wall, connected it to the drainage system. Blood and air bubbled into the collection chamber. James took a deeper breath, then another. His oxygen saturation climbed. 86, 90, 94. Better? Yeah, better. But his blood pressure wasn't better. 70/40 now. The bleeding in his abdomen was accelerating. I need an OR. Claire called out to no one and everyone. Dr. Chen appeared. All ORs are full. We have 9 critical patients and 3 surgical teams. He has internal hemorrhaging. He needs surgery in the next 20 minutes or he's going to bleed out. So do 4 other patients. Jen's face was tight. We're doing triage. Worst first. He is worst. Bay 2 has a patient with a severed femoral artery. Bay 6 has a tension pneumothorax with cardiac involvement. Your patient is stable for now. He won't be stable in 10 minutes. Then keep him alive for 10 minutes. That's the job right now. Chen moved to the next crisis. Claire stood over James, watching his numbers, calculating time, blood loss, probability of survival. This was the math she'd hated most. Battlefield triage, deciding who lives because you can't save everyone. She'd left that behind, or tried to. The trauma bay doors opened again. 2 more ambulances, 2 more patients, and then a 3rd ambulance. Military transport. The markings were subtle, but she recognized them. Medical evacuation unit from the nearby base. The patient they wheeled in was wearing the dust and blood of the construction site, but underneath, barely visible, was the tan pattern of a military combat uniform. His chest was soaked red, face pale, but his eyes were alert, scanning, tactical awareness even in shock. A paramedic shouted over the noise. Sergeant Michael Torres, 29 years old, penetrating chest trauma, steel fragment embedded below the clavicle, BP 60/30. He's compensating but not for long. The gurney passed Claire's bay. She caught a glimpse of the wound and froze. The fragmentation pattern, the entry angle, the way the metal had torn tissue. She'd seen that exact injury profile before. Not from construction debris, from an IED, specifically from a Russian-made fragmentation mine, the kind that scattered ball bearings in a cone pattern designed to shred soft tissue. But this was a construction site, not a combat zone, unless... Her eyes tracked the patient as they wheeled him to Bay 1. Watched the way he held his right arm tight to his body, protective, guarding. That wasn't shock posture, that was training. Keep your dominant arm functional even when wounded. Harrison took charge of the new patient, his voice cutting through the noise with rapid-fire orders. Claire forced her attention back to James. His pressure had dropped again, 65/35. She increased his IV fluids. Grabbed 2 units of O negative from the blood bank runner, hung them both wide open, but she kept glancing at Day 1, at the soldier who'd been at a construction site. Harrison was examining the chest wound, his face confused. This fragmentation pattern doesn't match structural steel. It's too uniform, too dispersed. One of the nurses spoke up. He was working demolition. Maybe it's from controlled charges? Demolition doesn't create this kind of... The patient's eyes opened, focused on Harrison. IED, training scenario. We were running combat engineering drills at the old site. What? Joint military-civilian project, training combat engineers to identify and disable IEDs using abandoned construction zones. Someone's device went live by accident. His voice was strained but clear. There are 2 more of my unit still incoming. Harrison's face went pale. You're telling me this is a military training accident? Yes, sir. Why wasn't the site cleared? It was cleared. The device was supposed to be inert. Someone made a mistake. Torres tried to shift position. Gasped. How bad is it? Harrison didn't answer immediately. He was staring at the wound, at the fragment embedded just below the clavicle. Claire knew what he was seeing. The fragment was close to the subclavian artery, maybe touching it, maybe holding pressure on a tear. If they pulled it out without surgical control, Torres would exsanguinate in minutes. Harrison looked up, scanned the trauma bay. Every surgeon was occupied, every bay full. His eyes found Claire. Ashford, I need you here. She looked down at James. His vitals were holding, barely. The blood transfusion was buying time. Go. James's voice was weak but firm. Help him. I can wait a few more minutes. Claire moved to Bay 1. Harrison stepped aside slightly. Let her see the wound. Tell me what you see. She looked. Really looked. The fragment was irregular, sharp, embedded at a 40-degree angle. Entry wound showed tissue damage consistent with high-velocity penetration. Her fingers touched the skin around the wound, felt for pulses, checked capillary refill. The fragment is compressing the subclavian, not severed, but if we extract it here, he'll bleed faster than we can control. Agreed. He needs vascular surgery. OR availability? 30 minutes minimum. Claire checked Torres's blood pressure. 50/20, dropping. She looked at his face, at the dust and blood, at the alert eyes that had seen combat, that recognized the same calculations she was making. And he looked back at her. Really looked. His expression changed. Confusion first, then recognition, then shock. Wait. His voice was barely a whisper. I know you. Claire's hands stilled. Kandahar, forward surgical team. You operated on my lieutenant after the convoy hit. His eyes were wide now. You're Viper 6. The trauma bay noise seemed to fade. Everyone in earshot turned. Harrison stared at her. What did he just say? Torres was still staring at Claire. Lieutenant Morrison, femoral artery severed. You performed a bypass graft in the back of a helicopter while we were taking fire. I was holding the IV bag. You told me to keep talking to him so he'd stay conscious. Claire's voice came out level. You're confused. The medication. No. Torres grabbed her wrist. His grip weak but desperate. I know your face. I know your hands. You taught me how to pack a wound during the flight. You said, pressure doesn't care about rank or fear. It just works. Harrison took a step closer. Viper 6? Torres didn't look away from Claire. Call sign for Special Operations Surgical Team. Forward deployed with Ranger battalions. She saved 43 lives in 6 months. He coughed. Blood flecked his lips. You just disappeared after Kabul. Everyone thought you died in the evac. The room was silent except for monitors beeping. Claire looked at Harrison, at Priya standing frozen nearby, at the dozen other staff members who'd stopped to listen, at the walls closing in on the life she'd tried to build, away from the one that had broken her. Dr. Harrison, her voice was steady, professional. This patient needs immediate surgical intervention. We can discuss my history later. The hell we can. Harrison's voice was low, dangerous. Is what he said true? Claire met his eyes. Yes. The word hung in the air like smoke after gunfire. Yes. Harrison's face went through 3 expressions in 2 seconds. Shock, anger, then something else. Something that looked almost like fear. You were Special Operations Medical. Yes. Embedded with Ranger battalions in active combat. Yes. And you've been working in my ER as a first year. Resident for 6 weeks without disclosing any of this. Claire looked down at Torres. His blood pressure was dropping, 45/20. His lips were turning pale. Dr. Harrison, we need to operate now or he dies. You can fire me afterward, court-martial me if you want. But right now, this soldier needs a surgeon who's done this procedure under worse conditions than a fully stocked trauma bay. Harrison stared at her. The monitors beeped urgency. Torres's breathing grew shallower. Fine. Harrison's voice was steel. But I'm assisting. And when this is over, you're going to tell me everything. Agreed. Claire turned to the nurses. Clear this bay. I need a vascular surgery tray 5O proline suture, vessel loops, and 4 units of O-negative running now. Get me a Foley catheter to monitor urine output and an arterial line for continuous BP monitoring. The team moved. Fast. Organized. But different now. They'd heard Torres. They knew what she was. Priya appeared with the surgical tray, Set it down without a word. Her eyes were wide. Claire pulled on sterile gloves, looked at Torres. Sergeant, I need you to stay with me. This is going to hurt. I can't put you under because I need you breathing on your own. Understand? Torres nodded. I've had worse, Doc. I know you have. To crit. The marketplace bombing. You carried 2 wounded soldiers half a mile to the extraction point with a dislocated shoulder. His eyes widened. How did you? I read the after-action reports. Your lieutenant told me about you while I was repairing his leg. He said you were the toughest son of a bitch in the unit. She positioned her instruments. So prove it. Stay conscious, stay still, and trust me. Yes, ma'am. Claire's hands moved into the familiar rhythm. The one she'd learned in places where mistakes meant body bags and hesitation meant failure. Betadine, the brown liquid spreading across his chest. Local anesthetic. Not enough to completely numb the area, but enough to take the edge off. Scalpel, the incision was 4 inches, just below the clavicle. Following the path of the subclavian artery, blood welled up immediately. Not spurting, not yet, but close. Harrison stood across from her, his hands ready, his face focused. Suction. Claire said, a nurse provided it. The blood cleared enough to see. The fragment was visible now, irregular steel, pressing directly against the artery wall. A small tear was visible, blood leaking slowly. The fragment itself was acting as a partial plug. If we pull that out, Harrison started, he bleeds out in 90 seconds. I know. Claire's voice was calm. We're going to clamp proximal and distal to the injury first, then extract, then repair. Her hands moved with absolute precision, years of training compressed into seconds of action. Vessel loop around the artery. Proximal side first. She slipped it underneath, gently. The tissue was fragile, damaged. Then distal, another loop. Clamps. Harrison handed them to her. 2 vascular clamps, curved, delicate. She placed them. Proximal clamp first. The blood flow stalked above the injury. Distal clamp next. Isolated the damaged section. Okay, extraction. She gripped the fragment with forceps, pulled steady and straight. The metal slid free. Blood filled the field immediately, but controlled now, contained between the clamps. Claire irrigated the wound, assessed the damage. A tear in the artery was small, 3 millimeters, clean edges. She could work with this. 5-0 proline. The suture was in her hand instantly. She threaded the needle, began to repair. Each stitch was perfect, precise. The kind of suturing that only comes from doing it hundreds of times under pressure. Her hands moved like they were separate from her body. Like they belonged to the surgeon she'd been. The one who'd operated in field hospitals while mortars fell. Who'd saved lives in the back of helicopters while tracer rounds lit up the night. The one she'd tried to bury. 6 stitches, each one exactly where it needed to be. She tied off the last suture, checked her work. Releasing distal clamp. The clamp came off. Blood flowed past the repair. The sutures held, releasing proximal. Full blood flow restored. The artery pulsed. Strong, regular, no leaking. Claire checked Torres's radial pulse. Strong. His color was improving. Blood pressure climbing. 60/30. 70/40. He's stable. She looked at Harrison. The artery's repaired. He'll need observation for potential complications, but the immediate crisis is resolved. Harrison stared at the surgical site, at the perfect line of sutures, at the work of someone who'd done this in conditions he couldn't imagine. He stopped, started again. I've been practicing vascular surgery for 2 decades. I've never seen technique that clean under that much pressure. Claire began closing the chest incision. You've never operated in a combat zone. No, I haven't. Torres was crying, silent tears running down his face. Thank you, Doc. Thank you. Claire's expression didn't change. Just doing my job, Sergeant. That's what you said in Kandahar, too. She finished the closure, dressed the wound, stepped back. The trauma bay was still full of patients, still full of noise, but everyone in earshot had stopped to watch. Priya stood near the wall. Her face showed something between awe and confusion. Dr. Chen had paused her own work, staring. Even the nurses had gone quiet. Harrison pulled off his gloves. Everyone back to work. We still have patients who need care. The spell broke. Motion resumed, but different now. Whispers spreading. The new resident isn't new. The quiet doctor isn't just a doctor. Harrison looked at Claire. My office. 20 minutes. Non-negotiable. Understood. She moved back to Bay 4, to James, who was still hanging on. His blood pressure had stabilized. The transfusion had bought him time. An OR had opened up. A team was prepping to take him to surgery. James looked at her. You saved that soldier. Yes. The way they were talking, you're not really a first year resident, are you? Claire checked his vitals one more time. It's complicated. My dad was military, Army medic in Desert Storm. He said the field surgeons were the toughest people he ever met. Said they operated under conditions that would make civilian doctors quit medicine. James's voice was weak but clear. Thank you for not letting me die while you saved him. You were never going to die, not on my watch. They wheeled him toward the OR. His wife had arrived, Emma. She was crying, holding his hand. Claire watched them disappear down the hallway. Priya appeared at her elbow. So, special operations, apparently. You were going to keep hiding it? I was trying to. Why? Priya's voice wasn't accusatory, just curious. That's the kind of experience people brag about. That's the kind of background that gets you into any program you want. Claire was quiet for a long moment, watching the trauma day, the organized chaos, the saves and the losses, and the thin line between them. Because I was tired, she said finally. Tired of making life and death decisions every day. Tired of measuring success in survival rates. Tired of closing my eyes and seeing the faces of everyone I couldn't save. So you became a first-year resident? Started over from the bottom? I wanted to learn medicine that wasn't about war, about trauma, about emergency decisions in impossible situations. Claire's voice was soft. I wanted to learn how to heal people when there's time, when there's light, when there aren't mortars falling and men screaming and blood everywhere. Priya studied her face. But you're still making those decisions, still saving people in impossible situations. I know. Maybe you can't run from what you are. Maybe not. The PA system crackled. Dr. Ashford to administration. Dr. Claire Ashford to administration. Claire looked at the clock. 20 minutes had passed. Time to face Harrison. Time to explain 6 years of classified service. Time to justify why she'd hidden the truth. Time to decide if she was ready to stop running from the surgeon she'd been. She walked toward administration, her footsteps silent on the linoleum, her hands steady. Behind her, Taurus's voice called out weakly, Viper 6. She paused, didn't turn around. You saved my life twice now. Thank you. Claire kept walking. Some debts couldn't be repaid with words, only with the work, only with the refusal to give up when everyone else already had. Harrison's office felt smaller this time, like the walls had moved closer while she wasn't looking. He sat behind his desk. Dr. Vance stood by the window. The legal counsel was back, holding a thicker folder now, and someone new. A woman in her 50s wearing a dark suit with a Department of Defense badge clipped to her belt. Claire took the empty chair, waited. The woman in the suit spoke first. Dr. Claire Ashford, or should I say, Major Claire Ashford, Medical Corps, United States Army Special Operations Command. Claire said nothing. I'm Colonel Patricia Reeves, Defense Medical Services Oversight. When the hospital legal team started making inquiries about your file, it triggered several alerts in our system. I've been authorized to discuss certain aspects of your service record. She opened a tablet. 6 years active duty, 3 tours, Afghanistan and Iraq, embedded with Tier 1 Special Operations Units. Specialization in combat trauma surgery and forward field medicine. Harrison leaned forward. Why isn't any of this in her civilian medical file? Because Major Ashford's service involved classified operations. Her medical work often occurred in locations and circumstances that officially don't exist. Reeves scrolled through the tablet. Her record shows 43 documented combat surgeries with a 96% survival rate, 3 commendations for surgical excellence under fire, 2 Bronze Stars, and a medical innovation citation for developing a field tourniquet technique that's now standard training. Vance crossed her arms. So why is she here pretending to be a first-year resident? Reeves looked at Claire. That's a question I'd like answered as well, Major. Claire met her eyes. I'm not active duty anymore. I'm not a major. I'm Dr. Ashford, a civilian physician trying to complete a residency. You didn't retire. You were medically separated following an incident in Kabul. The room temperature seemed to drop. Claire's jaw tightened. I was injured, deemed unfit for continued field deployment. Standard procedure. The official record says that. The classified addendum says something different. Reeves turned the tablet toward Harrison. August 7th. 3 years ago, Kabul province. Major Ashford was attached to a joint task force conducting raids on Taliban positions. During one operation, the team encountered civilians in the target building. 4 children. Command ordered the team to proceed with the mission. Major Ashford refused. She broke protocol, left her assigned position, and evacuated the children while under direct fire. Harrison read the screen. His face went pale. It says 2 of the children died. Because the extraction was compromised, Reeves continued. The Taliban used the confusion to counterattack. 3 Rangers were injured. The mission objective was lost. Command determined that Major Ashford's actions, while well-intentioned, violated operational security and endangered her unit. Claire's voice was quiet. The children were in the basement. Command intelligence said the building was clear. It wasn't. I heard them crying. You disobeyed direct orders. I did. You compromised a multi-million-dollar operation. I saved 2 children's lives and lost 2 others. The words hung there, heavy, final. Claire's hands were folded in her lap, perfectly still, but something in her eyes looked very far away. I wake up every morning and see their faces, the 2 I couldn't save. I hear them in every quiet moment. I carry them with me every single day. Her voice didn't waver, but I'd make the same choice again, because leaving them there to die wasn't an option I could live with. Harrison set down the tablet. So the Army kicked you out? The Army gave me a medical separation with honors and a recommendation for civilian medical work. Officially, I left due to accumulated combat stress. Unofficially, I was removed because I'd become a liability, someone who couldn't be trusted to follow orders when it mattered. Vance stepped away from the window. And you came here to start over. I came here to learn medicine that isn't about splitting second decisions between bad options and worse ones. I wanted to learn how to be a doctor when there's time to think, time to consult, time to do things right instead of just fast enough. But you brought all that training with you, Harrison said. All that experience, and you hid it. I didn't want to be defined by it anymore. I didn't want to be the combat surgeon, the one everyone looks at differently. The one who's seen things that make civilian doctors uncomfortable. Claire looked at each of them in turn. I wanted to be a student again, someone learning, someone who didn't have to carry the weight of 43 lives saved and God knows how many lost. The legal counsel cleared his throat. Dr. Ashford, your combat experience is extraordinary. But you violated hospital protocol multiple times. You performed procedures without authorization. You endangered your medical license and this hospital's accreditation. I saved 3 lives today. That's not the point. That's the only point that matters. Reeves closed her tablet. Major, Dr. Ashford, the military made a mistake 3 years ago. Your actions in Kabul showed judgment and humanity in an impossible situation. The 2 children you saved are alive because you refused to follow orders that were based on faulty intelligence. Claire looked up sharply. What? The classified review concluded that command intelligence was wrong. The building wasn't clear. The Taliban had been using it as a civilian shield for weeks. The operation was compromised before your team ever entered. Reeves's voice softened. The 2 children who died were killed by Taliban fire, not because of your actions. You were set up to fail, and then you were blamed for it. The silence stretched. Claire's hands finally moved, unclenched. Her breathing changed. Something that had been tight for 3 years started to loosen. I didn't know that. It was classified above your clearance level. The review was completed 8 months after your separation. By then, you'd already disappeared into civilian life. Reeves stood. I'm here to offer you something. The Department of Defense is establishing a new training program, Civilian Military Medical Integration. Teaching combat trauma techniques to civilian emergency physicians and bringing field medics into hospital environments for advanced training. We need someone to design the curriculum, someone who understands both worlds. Harrison sat up straighter. You want her to leave St. Catherine's? I want her to split her time, civilian practice and military training. Use her experience where it can do the most good. Reeves looked at Claire. You've been running from what you are for 3 years. Maybe it's time to stop running and start teaching others what you know. Claire was quiet for a long time. The office sounds filtered in. Footsteps in the hallway. A distant phone ringing. the normal sounds of a hospital that kept moving no matter what happened in this ring. Finally, she spoke. I have conditions. Vance raised an eyebrow. You're in no position to make demands. Respectfully, Dr. Vance. I just saved 3 critical patients in the span of 4 hours using techniques that aren't taught in any civilian program. I think I've earned the right to state my terms. Harrison almost smiled. Almost. What do you want? Reeves asked. First, I stay at St. Catherine's. I complete my residency here, properly, not as a special case or a celebrity, as a resident who does the work and learns the civilian medicine I came here for. Agreed. Second, the trauma training program isn't just for military personnel. It's open to any civilian doctor who wants to learn. Inner city hospitals, rural emergency rooms, anywhere that sees high trauma cases without resources. Reeves considered. That's a bigger scope than DoD was planning. That's the scope that matters. Combat medicine techniques save lives everywhere, not just on battlefields. I'll have to get approval. Then get it. Vance leaned against the desk. What's your third condition? Claire looked at Harrison. I want to work with someone who'll challenge me, who won't give me special treatment because of my background, who'll hold me to the same standards as every other resident. Harrison met her eyes. You want me to keep treating you like a first year who doesn't know anything. I want you to treat me like a resident who has trauma skills, but needs to learn everything else. Surgery electives, internal medicine rotations, pediatrics, all of it. The parts of medicine I never had time to study because I was too busy keeping soldiers alive in war zones. That's fair. And I want you to call me out when I revert to combat protocols instead of civilian ones, when I make decisions too fast, when I skip steps because I'm used to operating with less. I want to be better, not just faster. Harrison was quiet for a moment, then nodded. I can do that. Reeves made notes on her tablet. I'll take your conditions back to DoD. But unofficially, I think they'll approve. This program needs someone like you, someone who's lived in both worlds and understands what's missing in each. The legal counsel gathered his papers. For the record, Dr. Ashford's actions today saved 3 lives. Given the extraordinary circumstances and the revelation of her background, I'm recommending the hospital drop all disciplinary proceedings. Vance sighed. Agreed. But Dr. Ashford, if you ever perform an unauthorized thoracotomy in my ER again, I don't care how many lives you've saved. We'll have this conversation a second time, and this. The outcome won't be as positive. Understood. They stood. The meeting was ending. The crisis was resolving into something like normalcy. Reeves paused at the door. For what it's worth, Major, the Army made a mistake letting you go. You're one of the best combat surgeons I've ever reviewed. I'm not a major anymore, Colonel. I'm just Dr. Ashford. Maybe, but those kids in Kabul who are alive today would disagree. She left. Harrison walked Claire to the door. You know everyone in this hospital is going to treat you differently now. I know. The residents are going to be intimidated. The attendings are going to expect perfection. The nurses are going to watch you like you're some kind of miracle worker. I'm aware. How are you going to handle that? Claire thought about it. The same way I handled being Viper 6. Do the work, save the lives I can, accept the ones I can't, and try to teach anyone willing to learn. Harrison held out his hand. Welcome back, Dr. Ashford. Let's start your residency over, properly this time. She shook it. Thank you, Dr. Harrison. Call me Victor. If we're going to work together, we might as well use first names. Then call me Claire. She walked out of administration. The hallway stretched ahead. Clean, white, normal. Behind her, 3 years of running. Ahead, the work she'd been meant to do all along. 6 months later, the simulation lab at St. Catherine's had been transformed. What was once a dusty storage room on the 4th floor was now a state-of-the-art training facility. Trauma mannequins lined the walls. Portable surgical equipment filled metal carts. And in the center, 12 residents sat in folding chairs, notebooks open, faces attentive. Claire stood at the front. Her hair was shorter now, professional. She wore standard surgical scrubs, with a small patch on the sleeve. CTIP, Civilian Trauma Integration Program. The difference between a combat surgery and a civilian one isn't the procedure, it's the context. Her voice carried clear across the room. In a hospital, you have light, backup, equipment, and time. In the field, you have whatever you carried in, whoever's standing next to you, and however long before the enemy figures out where you are. She pulled a mannequin forward. This is a simulated penetrating chest wound. Standard protocol in a civilian ER is immediate transport to OR, full surgical team, controlled environment. But what happens when the OR is 40 minutes away? When the patient won't survive transport? When you are the full surgical team? A hand went up. Young resident, first year. You adapt the procedure? You adapt everything. Your tools, your technique, your expectations. Claire picked up a scalpel. Standard thoracotomy incision in an OR is 8 to 10 inches. You have time to be precise. In the field, you make it 6 inches and you make it fast, because precision is a luxury you can't afford when someone's bleeding out. She demonstrated on the mannequin. Her hands moved with the same confidence they always had. Muscle memory that 3 years of civilian medicine hadn't erased. But here's what matters more than technique. Recognition. Knowing when to use these procedures and when not to. Combat medicine is about acceptable outcomes in impossible situations. Civilian medicine is about optimal outcomes in controlled ones. You need to know which situation you're in. Another hand, older resident, military background visible in his posture. How do you make that call? Claire set down the scalpel. Resources, personnel, time, environment. You assess all 4 in the first 10 seconds. If you have the resources and time, you use standard protocols. If you don't, you use what works. And you accept that what works might not be textbook perfect. She pulled up a slide on the projector. Statistics, survival rates, complication percentages. Since this program started 6 months ago, we've trained 48 emergency physicians in field trauma techniques. Those physicians have reported a 23% improvement in survival rates for critical penetrating trauma. Not because they're doing anything radical, because they're recognizing complications faster and adapting procedures to emergency conditions. Priya sat in the back row. She'd become Claire's assistant instructor, teaching suturing techniques to first years and running simulation scenarios. She raised her hand. Tell them about Chicago. Claire paused. That's not my story to tell. It's exactly your story to tell. The residents looked between them, curious. Claire was quiet for a moment, then nodded. 3 weeks ago, a building collapsed on the south side of Chicago. Old apartment complex. 30 people trapped. One of the physicians who completed this program was first on scene. He performed 2 field amputations to free trapped victims and 1 emergency thoracotomy in the back of an ambulance. All 3 patients survived. She pulled up another slide. Photo of a doctor standing next to a patient in a hospital bed. Both smiling. That's Dr. Ashford. Marcus Webb and the patient whose life he saved with a procedure he learned in this room. Dr. Webb wrote me last week. He said, and I quote, "I never thought I'd use that training. I hoped I'd never need it. But when the moment came, my hands knew what to do because you taught them." The room was silent. That's why this program exists. Not to train combat surgeons, to train civilian physicians who can handle the worst day of their careers when it arrives. Because it will arrive. And when it does, you'll either have the skills to adapt, or you'll watch people die while you wait for perfect conditions that aren't coming. A pager went off. Then another. The familiar cascade of emergency alerts. Claire checked hers. Mass casualty alert. Multi-vehicle accident on the interstate. All available trauma staff to ER. She looked at the residents. Class dismissed. Let's go to work. They moved as a unit. Fast, organized. Down the stairs to the ER. The trauma bay was already transforming. Nurses prepping bays, attendings gowning up. The organized chaos. Claire had come to appreciate in civilian medicine. Controlled, methodical, everyone knowing their role. Harrison was there, directing, assigning. He saw Clam and nodded. We've got 6 incoming. 3 critical. I want you on the worst one. Copy. The first ambulance arrived. Then the second. Then the third. Claire took Bay 2. The patient was a woman in her 40s. Steering column had crushed her chest. Respiratory distress. Hypotensive. Deteriorating fast. Claire's hands moved into their rhythm. Assessment. Diagnosis. Decision. Priya appeared beside her. What do you need? Chest tube tray, and get me a trauma surgeon. She's going to need an OR, but I can stabilize her here first. The work happened like it always did. Fast. Precise. The product of thousands of hours of training and experience distilled into minutes of action. The woman stabilized. Vitals improved. They wheeled her to surgery. Claire stepped back, washed her hands. The blood swirled down the drain like it always did. Harrison appeared at her shoulder. Good work. She wouldn't have made it without that tube. She had time, unlike some cases. You're getting better at knowing the difference. You're getting better at teaching me. He smiled. Actually smiled. You know, when you first showed up here, I thought you were going to be a problem. Someone with too much ego and not enough humility. And now? Now I think you're exactly what this hospital needed. What civilian trauma medicine needed. Someone who understands that perfect technique matters less than perfect judgment. A familiar voice called from across the bay. Dr. Ashford. Claire turned. Sergeant Michael Torres stood near the entrance, out of uniform, civilian clothes. He walked with barely a limp. The scar on his chest was hidden under his shirt. She walked over. Sergeant, you're looking well. Thanks to you, twice. He held out an envelope. I wanted to give you this in person. She opened it. Inside was a photo. Torres in dress uniform, standing next to a young woman in a wedding dress. Both beaming. Got married last month. Emily. We met during my recovery. He smiled. I wanted you to know. The life you saved isn't just mine anymore. It's ours. It's the family we're going to build. The kids we're going to have. All of it exists because you refused to let me die. Claire looked at the photo for a long time. Congratulations, Sergeant. There's something else. He pulled out another photo. Older, worn. Remember Lieutenant Morrison? The femoral artery repair in Kandahar? I remember. He's a physical therapist now. Works with wounded veterans. He's helped 43 amputees learn to walk again. Torres handed her the photo. He sent me this, said to give it to you if I ever found you. The photo showed a man with prosthetic legs running a marathon. Bid number 43. For the lives saved by his surgeon. He wants you to know that the life you saved multiplied. Every veteran he's helped walk again is part of your legacy. Every family that got their soldier back is part of what you started. Claire's eyes stayed on the photo. Her expression didn't change, but something in her face softened. Just slightly. Tell him thank you, and tell him I'm proud of the work he's doing. I will. Torres shook her hand. Take care of yourself, Doc. The world needs more people like you. He left. Claire stood holding the photos. The wedding. The marathon. The evidence of lives continuing because she'd refused to give up. Priya appeared beside her. You okay? Yeah, I'm okay. You know what Harrison said is true. You changed this place. Changed how we think about trauma. How we teach it. How we approach it. We changed it. You and me and everyone who took the training seriously. But you started it. You brought something here that didn't exist before. Experience that matters. Knowledge that saves lives. Claire looked around the trauma bay, at the organized chaos, at the residents learning, at the patients being saved by people who'd learned to adapt their skills to impossible situations. I spent 3 years running from who I was, trying to bury the combat surgeon and become someone else. Someone softer. Someone who didn't carry all that weight. And now? Now I realize you don't bury parts of yourself, you integrate them. The combat surgeon and the civilian physician aren't different people. They're the same person who learned to work in different contexts. And both versions matter. An alarm went off. Another patient arriving. Another emergency. Claire pulled on fresh gloves. Let's go. They moved together into the controlled chaos. And in the back of Claire's mind, in the place where she kept the faces of everyone she'd saved and everyone she'd lost, something shifted. The 2 children from Kabul were still there. Would always be there. But now they were surrounded by others. Torres and Morrison, and Marcus Wedd's patient, and the woman with the crushed chest, and 43 soldiers who'd survived impossible wounds. The weight was still there, but it felt different now. Not like a burden. Like a responsibility worth carrying. The monitors beeped. The PA system called. Someone laughed in the distance. Normal hospital sounds. Safe sounds. Sounds of a place where people came to be saved. And Claire Ashford, who'd learned to save lives in the darkest places on earth, had finally found a way to save herself. By accepting that running from what you are is impossible. But learning to carry it with grace is a choice you make every single day. She chose grace. She chose the work. She chose to keep saving lives one patient at a time until her hands couldn't move anymore. And when the shift ended 6 hours later, she walked out of St. Catherine's into the evening light, exhausted and bloodstained, and exactly where she was meant to be. The door closed behind her. Tomorrow would bring new emergencies, new patients, new impossible decisions. But tonight, she could rest, because she'd finally stopped running. And the weight she carried felt lighter when she wasn't carrying it alone anymore.